Psychosis. So, um, what exactly do we mean by psychosis? A lot of the times, this is the image that comes to one's mind. Somebody who is probably aggressive, agitated, behaving out of sorts. But when you look at it from a different perspective, from the mind of the person, it is more of them having losing touch with reality. What they are thinking or what they are perceiving is different from what is actually real. And so for them, it is different. Their perceptions and their thoughts are disrupted due to some chemical processes that are going on in the brain, which has to do with neurotransmitters such as dopamine, serotonin, and noradrenaline. So you find them finding it difficult to distinguish between what is real and what is actually not real. Now, there are three major features in which someone with psychosis experiences, which is hallucinations. Now, it could be with smelling, it could be with seeing, and it could be with hearing. So sometimes they can be hearing other people talking to them. So it's like a third person. And at times, it could be that they're hearing the person saying things like, "Oh, I'm going to kill you," or "I'm going to harm you." So, in situations whereby it's a patient maybe who is being taken care of, who is being cared for by someone or a caregiver, sometimes they may say that the person is trying to kill them, that they know that they've poisoned their food. And these are just actually hallucinations. They say somebody is telling them, someone has whispered to them that, this is what the person is doing. They also have delusions, and we can define delusions as fixed false beliefs. Some are persecutory, some can cause them to be paranoid as well. Then we also have what is known as thought dissociation, a dissociation between what they're thinking and the way they and what they are saying. So when they speak, their words are jumbled up. It doesn't make sense. They can be talking about one particular topic and move from one topic to another, and there is no link between any of them whatsoever. So these are the three major features that those who experience psychosis have: hallucinations, delusions, and thought disorders. So it's really important to actually listen to them. So this is a picture of mumbled up letters, more or less, to have an idea of um, in the mind of the patient, what exactly is going through their mind. Everything is jumbled up, nothing is arranged. Now, thought disorganization. What are the different uh, types? We have allogia, which is little information conveyed by speech. We have tangiality, which is answers diverse from the topic which I spoke about. They talk about one thing, they could be talking about cars are speeding down the road, and then the next thing they're talking about is butterflies are flying in the forest, and so on. Then clanging, which is putting words together based on how they sound. So it's not what they're saying doesn't make sense. They speak in a way based on the sounds that the alphabets or the words make, and to them it makes sense. Then we also have the word salad, which is words that are not linked together. Like, for example, fruit, wardrobe, road, paper, pen. They don't make sense. Everything is jumbled together. So you see from the image here also just words or sounds, however it can be put together. But you see, this is what the patient is experiencing. So some of these words can come out in the question, and it says that maybe it's a relative that brings the patient to the clinic and says that, whenever they are talking, it doesn't make sense, or they move from one topic to another, and they ask you to pick which one of them is the symptom that the person is experiencing, and they can give you these words: the allogia, tangiality, clanging, and the word salad. So psychosis can occur in different psychiatric illnesses. One of them is schizophrenia, another one is puerperal psychosis, bipolar disorder, depression, and you can also see it in those who use illicit drugs such as cannabis. And cannabis also poses a risk for patients to actually develop certain psychiatric illnesses such as schizophrenia. Then we also have those prescribed medications such as corticosteroids. So we have the image of a woman, and that just helps us to remember